The approach that we chose to use is called the Vowel Targeted Intervention, and it's used for children who have limited vowel inventories. There's not that much research out there about vowels because it's not a very common problem. And so our approach increases vowel inventory, and it uses either cards or picture cards based on the age of the client. And the data is collected at the beginning of the session, or beginning of the year, and at the end of the semester or the targeted. This approach uses a sequence, and each time you don't move on to the next part of the sequence until the client masters the part you're working on. So first you start with minimal pairs, then rhyming activities, sorting words, silent sorting of words, then segmentation, articulatory drills, and then word phrases.
Children that benefit most with this intervention are those children with severe phonological impairment, specifically with the idiosyncratic process of vowel processes. The children that also benefit most are those with an impaired vowel system or a small vowel inventory. These children, like Colleen already mentioned, are very rare and are not very often seen in therapy. How to select target vowels and sounds for these children will differ between the individuals. So it's based on each individual's assessment, and it's going to be different for each child. It's also based on the percentage of vowels correct, or the PVC, and the percentage of consonants correct, or the PCC. PVC is found at baseline, and standardized tests such as the SPAT-D2 is used to get the child's PCC and their PVC.
In order to collect the baseline data, we use a picture-based assessment to elicit the vowel sounds in different contents. Also, the monosyllabic words were used in the word shapes VC, CV, and CVC. For instance, we used some of the words pie, high, bed, and beg were used to establish the baseline, which then led to the standardized testing. Throughout therapy, it's important to remember to give accurate and specific feedback, and not just for each sequence, but to remember to not move on until you finish that sequence part.
There are several advantages and disadvantages to using the VTI approach. Some advantages are, even though there's a small amount of research has shown that it does leave a positive impact on the intelligibility of these children's speech. Another advantage is that VTI can be incorporated into early intervention programs. It's very easy to administer, and multiple activities to deliver the intervention can be used. Some disadvantages to the VTI approach is that it's rarely used successfully on a young child because they have to be able to read the card, and that's just difficult, and if they're younger and they can't read, then they can't participate. Also, it cannot be used with a child with hearing loss or a child with a cleft lip or palate. Few cases have been really done or researched, so that's another disadvantage, is there's not a lot of evidence to back it up. And also, this therapy cannot be used by itself. It needs to be used in combination with other therapies.
The proposed client that we use in our video is named Kim, and she is 23 years old. She has a small vowel inventory, but she does not have any other disabilities with that. So first we use the SPAT-D2 test and have collected her PVC and PCC. This, along with the baseline data, revealed that she is missing the vowels E and I. So we chose to work on these two errors because they affect her intelligibility a lot, and they were the most frequent errors in the test that we used. So here's an example of our video targeting the E and the I. Hi, how are you doing today, Kim?
I'm okay.
Yeah, all right. Okay, well, we're going to work on a few different things to practice your vowels today. And first, I'm going to do some minimal pairs, and I'm going to say two different words and have you point to the word that I say, okay?
Okay.
So we have pie and we have paw. Can you point to paw? Perfect, very good. Let's try another one. We have high and taw. Point to high. Good, good. And one more of those. Buy and baw. Point to buy. Great job. Okay, now we're going to work on the other vowel sound, the E sound this time. So we have bud and bed. Point to bed. Great job. Okay, we have bug and beg. Point to beg, please. Great. And one more of those. We have duck and we have deck. Can you point to deck? Perfect. You've got the minimal pairs down. Okay, now we're going to move on and we're going to look at some rhyming words, okay? So, I'm going to read these words and I want you to point to the two words that you think rhyme, okay? So, we have bed, head, and hut. Very good. You picked bed and head. Those two words do rhyme. Now let's try one with our I sound. We have fly, paw, and tie. Good. Fly and tie do rhyme. Very great. Good. All right. So now we're going to move on to we're going to sort our words into different piles based on our vowel sounds. Do you remember what two vowel sounds we're working on?
I and
Great. Okay, so we're going to do these words. And I'm going to have you put them into piles based on those two sounds, okay?
Okay.
So we have high, fly, bed, and head. Can you put those into piles, please? All right, and what words do you have in this pile?
Fly and high,
And how about this pile?
head and bed.
Okay, great. You did get the for this pile and the I for this pile. Let's try one more pile sorting activity with those. Okay, we're going to sort these words, and I'm going to have you say them in your head and sort them into piles, please. Okay, can you tell me which piles you have now?
This is the I pile. This is the
Perfect. And what words do you have in your pile?
This is the pile.
Oh, whoops. Let's try again. Listen to
Okay.
these sounds in these words. Said, bed. Do you hear the Can you try saying Okay, so we have said and bed is our the pile.
Okay.
And this is our I pile because we have guy and side.
Okay.
Can you say these two words, please?
Guy and side.
Perfect. Great job with that. All right, now we're going to move on and we're going to segment some words. So we're going to break the words apart, okay? And so the words that we're going to break apart are bed and kite. So can you break apart the word bed for me? Say it using your syllable sounds this way.
B-E-D.
Great, you separated that perfectly. And how about kite?
K-I-T.
Very good. You've got that skill down. Okay, now we're going to work on repeating some of our words, okay? So we're going to start with words with the I sound. And we're going to say each of these 5 times, okay?
Okay.
So, go ahead.
Guy, 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 guy.
Perfect. All right, and now we're going to do ice.
Ice, 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 ice.
Very good. And one more. Kite.
Kite, 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 kite.
You had great I sounds in all
Okay,
of
now
those
we're gonna
words.
do our
S sound, and we're going to say each of these ones 5 times. Now, some of these are non-words. They're not real words, but we're still going to practice with them. So, the first one, we're going to say be 5 times.
Be, 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 be.
Okay, good job. And how about ed?
Ed, 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 ed.
Good sound. And one more, bed.
Bed, 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 bed.
Good work. That was great repeating. Okay, and we're going to have one more activity. And this one, we're going to use different words, and we're going to put them, say the word, and then we're going to say a phrase, and then we're going to make a sentence. So the first one, we have the I sound. We have kite. Can you say kite, please?
Kite.
All right, now let's make a phrase with this one. Fly a kite.
Fly a kite.
Okay, and the last one, we're going to say, I like kites.
I like kites.
Good. That was very good. Okay, and our last one is bed. We'll do the same with that, please. Bed.
Bed.
All right, now we're going to put it in a phrase. In the bed.
In the bed.
Okay, the last one. Can you say, I like sleeping in the bed?
I like sleeping in the bed.
All right, good sentences and phrases. And that's all we're going to work on today. So you did very good with all of our activities. And we'll just keep practicing our I and our S sounds next week. Thank you.
Great, thanks.